Hello everyone, greetings to you all from Perinatology Committee FOXY for today's TOG webinar on role of micronutrients in improving immunity in pregnancy. We indeed have a really power-packed panel discussion today with absolutely the past president, future president and very much power-packed faculty with us today. And before we start, I would like to thank Dr. Alpesh Gandhi, President FOXY, for this opportunity. And we would like to thank ICOG for giving us one accreditation point. Thank you, Dr. Meg ma'am and Dr. Parag Biniwale. So as we go ahead with the panel discussion, I would, before we start, I would like to say a few things about our committee, that is Perinatology Committee FOXY. This is my third year that I'm working as chairperson of the committee. During the first year and the second year, we've done more than 80 CMEs all over the country, social programs, hands-on drills, workshops. Last year with Dr. Nandita Palshetkar, we launched a FOXY focus on preterm labor. Madam will join us shortly now. And regarding today's topic and our panelists, I would like to welcome Dr. Shanta Kumari ma'am. Madam is, as we know, President-elect FOXY 2021. She was chairperson FOXY ICOG in 2018, and we all know she's highly dynamic. Welcome, ma'am, on this panel discussion today. And thank you, ma'am. And we have with us Dr. Dipendu Banerjee. Sir has been president of Bengal OBGY Society 2019-20. And sir, we are indeed privileged to have you with us today on our panel discussion.
Thank you. Thank you very much.
And we know Dr. Nandita Palshetkar. She's been President FOXY last year. And we are waiting. Ma'am will join us shortly. So I think before we start the panel, when we talk about nutrition, our topic today is not macronutrients, but micronutrients. So micronutrients, what does it really mean? It covers a huge umbrella which consists of various vitamins and minerals. And why is it so important? It's because these minerals and these vitamins, they regulate the cellular function, the molecular function, and they are essential in the normal functioning of the body. In fact, there is a concept of fetal origin diseases, chronic diseases like diabetes, hypertension, cardiac diseases. All these, they say, begin in utero, and hence the in utero maternal environment is so very important for the fetal growth. So if the mother's nutrition is adequate, the mother's nutrition and the mother's well-being has a huge impact on the fetus and the neonate. And that is the reason we are discussing today micronutrients and the rising immunity, the way they help us in increasing the immunity. Now, talking about immunity, in this difficult era of today and this pandemic happening and immunity, everybody is worried about immunity, not only the patient, the doctors, the masses, everybody. And talking about nutrition, everybody has different opinions and different takes on it. So we have a small video which is a little comical about what are different opinions that people have about nutrition and immunity. We would like to play it now.
What if I told you that 1 out of every 5 pregnant women in the United States goes to bed hungry? Now, what if I told you that because they went to bed hungry, their babies are now prone to have a chronic disease as an adult? And not only that, but their grandchildren as well. This unfortunate fact is a huge problem.
On the other side of the spectrum, 1 out of every 3 pregnant
The movie could not be seen, Vaishali.
Yeah, yes, ma'am. Yes, ma'am. Maybe we can play it again. Right now we couldn't see it properly. So maybe midway we'll play it. It's a small comical clip.
What if I told you that 1 out of every 5 pregnant women in the United States goes to bed hungry? Now,
it can't be seen. It's not working.
Yeah, it looks like it's not working. Welcome, Dr. Nandita Palshetkar. We are indeed privileged to have you here today. This is the second webinar of Perinatology Committee, FOXY. And we all know Nandita ma'am as a very dynamic past president, FOXY, president, AMOGS now, and so many achievements to her credit. And so can we start with the panel discussion, ma'am? Nandita ma'am, are you there, ma'am? Can we start with you?
I'm there. Dibendu is there. I can see him. Shanta, I can see her.
Yes. Yeah. Everyone is here. So, ma'am, the today's topic is role of micronutrients in increasing immunity during pregnancy. So, coming to the first question, we would like us to give us some guidance about what are the key effects of maternal nutrition on the fetal immunity, and are micronutrients important for boosting the immunity of the mother and then the fetus and the neonate? Would like your opinion.
Vaishali, I think first we must understand that, immunity is affected by various factors, okay? And nutrition happens to be one of the factors. So I think it's very, very important. And because I was preparing for this, I was reading there's a nutrition review in 2018, October, which actually said that, nutrition is one of the most important factors which affects immunity. So even our lifestyle problems can affect, the type, the prevalence, the severity of the infection. So immunity initially in 1990s were thought to be, only infection related and all. But even in 1978 or something, they came up with a thing that the reduced immunity can actually cause diseases, the fetal origin of adult disease. They postulated at that time. So, so far back, nutrition, immunity, other diseases are connected. And I think it's very important that we understand it. So first of all, what is micronutrient? Everybody needs to understand what is the difference between a macronutrient and a micronutrient. Macronutrients are fats, carbohydrates, and proteins. But the micronutrients are, the vitamins, the fat-soluble, the water-soluble ones, and some minerals. Minerals like, zinc, magnesium, selenium, etc. So all these are important because their deficiency can cause a deficiency in the immune system and can cause problems. So remember one thing about micronutrients is that what was always said is that, the diet may not give us the micronutrients. Yes, the macronutrients can be given up by our diets, but the micronutrients, it's very, very difficult to, supplement it through diets. And the implications is also, if you go to see cancers, autoimmune diseases, chronic illnesses, etc., all these can be because of the micronutrient deficiency. And some of them, if you want to, I will just talk about some of them. Iron, for example, we think it's only required for anemia, but no, it has an antioxidative effect also. So the oxidative stress can be taken care of it. Then the folate, not only the neurodevelopment, but also the appropriate epigenetic expression of a genome is required, the folate is required. Zinc, if you see, fetal growth and development. Calcium, calcium not only for bones and teeth, but lymphopenia, fetal immune deficiency. It's something called as fetal immune deficiency thymic atrophy can be caused by calcium. So all these things can definitely be caused. We know the vitamins A, the vitamin B, and I think the whole point of this seminar today is to understand that today what we are doing for our patients is to give them a better future. And if all these problems which affect pregnancy are taken care of, I think it'll really, really be very, very helpful.
Yes, ma'am. Yeah, very, very well guided, ma'am. Right from the way fetal origin of chronic diseases till now today, how nutrition is important, how every micronutrient works at what cellular molecular level. Very well explained, ma'am. And what is also important to receive the nutrition, the diet is extremely important. So each pregnant patient, in fact, right from before pregnancy, we should be guiding them about the nutritious and balanced diet, like for vitamin A, carrot, spinach, milk, cheese, or vitamin C, how citrus food is important, or vitamin E, for example, nuts, walnuts, almonds, how each of these vitamins and which food to get the perfect balance of that nutritious balanced diet is very important. Thank you, ma'am.
Shali,
Yes,
here I want to interrupt you that
Yes,
there are lots of things which prevent absorption and all. So sometimes, especially when during pregnancy, I feel the diet may not be sufficient enough to give you the micronutrients. So yeah, you have to be careful when what kind of conditions you're prescribing them in, and what is that person's health system.
Yes, absolutely right, ma'am. Correctly said. So, can we ask Dr. Shantakumari, ma'am? We would like your opinion about the prevalence of deficiency of micronutrients in a pregnant women, and any guidelines which recommend that what is the level of micronutrients, the reference value, how much supplementation should be given, because like ma'am said, the diet alone is not enough, so we need to give them supplementation. So how much is recommended, ma'am?
Your volume.
Hello. Yes, Vaishali, that is a very interesting point which Nandita has brought into focus. Is all of us actually talk about nutrition, but we all think we are experts in nutrition, but unfortunately everyone's knowledge of nutrition is to cooking recipes and doling out food and different varieties. But when it comes to the exact necessity about knowledge about micro and macronutrients, all of us have our shortcomings. See, so when you look at the guidelines, where there are some countries which say, for example, European countries, they get most of their micro and macronutrients from the diet. So the requirement of micronutrients in a European community is much lesser compared to our country. So if you take any of the Asian countries, why is it so? It is so, not only in the socio-economically weaker section, it's there across all the socio-economic groups in our country. It is because of the diet fads. See, because of the vegetarian diet, or because of the fads and some restrictions or whether some taboos of food. So that is the most important factor for these deficiencies. So looking into all this, the WHO had given guidelines. I don't know in future if we are going to follow the WHO guidelines. But as on now for the micronutrients, let's see, because I think from now we have got our ICMR guidelines also. But let's just go into this. The WHO currently said that you need micronutrients like the iron and folic acid supplementation. All of us know. The gynecology obstetricians around across the length and breadth of the country know that we need to supplement iron in our diet. It's not there, and anemia is most prevalent. So we have almost, some studies have shown in pregnancy more than 80 to 90% of women are anemic. There are some studies which say 50 to 60%, and studies have shown school children more than 70 to 80% are anemic. So that means we need to supplement. So we have to remember that we have to supplement daily elemental iron about 30 to 60 milligram with folic acid. That is the need of the hour. And the other most important is calcium supplementation. Now, how much of calcium to give? What are the recommendations? I'm sure Nandita will agree with me. When we did the calcium TOG last time on the requirement of calcium and all, we realized actually there are very few reports and studies about calcium requirement in pregnancy or otherwise. I think we think we know a lot about it, but we really don't have much of evidence. So WHO says, okay, 1.5 to 2.9, almost 3 grams of oral elemental calcium in those who have deficient calcium intake. See, in our own country, everybody doesn't drink about a liter of milk or a glass. If they drink a cup of tea with maybe 15 ml of 10 ml of milk, 3 times if you add it also, maximum they may be getting in a day about 30 ml of milk, which is not sufficient to supplement the calcium. And eggs, not all the population has eggs. Then meat, of course, restricted. So that shows how vital calcium supplementation is in our diet. Of course, vegetables, fruits does have calcium, but that is not enough to give the required calcium. And vitamin A supplementation is also vital, about 10,000 to 25,000 units. And the most important, zinc supplementation. Nowadays, with this COVID pandemic, all of us have come to one idea. We have been hearing a lot about this zinc. Zinc supplementation is very, very vital. Now, why is zinc important? It is one of the most important micronutrient, which is responsible for a lot of all pathways in the system, the immunity, everything. That is why zinc supplementation is definitely recommended, and along with it, vitamin D. We always thought we are living in such a hot country, India. I also thought we never thought that we will be vitamin D deficiency. But, well, the exposure to sunlight is very minimal, and we find that those who are exposed to sun are also not getting the required vitamin D. So that puts even vitamin D as one of the most important vitamin which is to be supplemented. So that's how the guideline goes. Next, we have the dietary reference values. Now, you take, I wanted this slide to be put when I'm talking, because, all of us really can't remember what is the daily dosage of requirement of thiamine, riboflavin, niacin. But what we need to understand is, when you look at the reference value, the thiamine, riboflavin, niacin, if you want me to read out, it's about 1.4. Riboflavin is 1.4, niacin is 18. Vitamin B6 is also very vital. That's also deficient in most of the diets. And we've got folic acid. Of course, we have stressed on the addition of folic acid. Then vitamin C, A, vitamin D, and calcium, phosphorus, magnesium, sodium, potassium, iron, zinc, copper, selenium, and iodine. When we're talking about this sodium and potassium, we always thought salt restricted diet is very good for all of us. But if you look into our general population, little as we age, we are finding a lot of our older people are going into the sodium deficiency. They're having high hyperkalemia and low sodium. So that is again something to do with how they need to actually modify their diet, and also that adequate amount of sodium is incorporated in the diet. So this is about the dietary reference value. And let me have the next slide on the daily recommendations. So coming to the simple slide, calcium 1.5 to 2 grams per day, vitamin D 1000 international units per day, vitamin A is 800 micrograms per day, vitamin C 85 milligram per day, vitamin E 15 to 2 milligram per day, 1.5 to 2 milligram, vitamin B6 1.9 milligram per day, zinc 12 micrograms per day, iron 30 to 60 milligram per day, iodine is also 100 to 150 micrograms per day, folic acid we all know. So these are the daily recommended dietary allowances. So this is a chart which shows the allowances of the vitamins, micronutrients, and macronutrients for pregnancy. So you once you click it and see it, you understand that you need all these for a normal functioning woman, so that she doesn't have any of the deficiencies and you have a healthy baby, which could be the outcome.
Thank you, ma'am. You have really elaborately explained, and with reference values, that was wonderful. And what is also right is with even balanced nutrition, we do not get the required amount of micronutrients. So what has been incorporated nowadays is fortified foods. For example, iodized salt. And even in that, there's a recommendation that 1/4 teaspoon of the salt should have 95 milligram of iodized salt. So fortified food for vitamin D, for iodine is also very much in, and I think we should be encouraging our patients to avail to that also. So can we move on to Dr. Banerjee now? Sir, we would like to know your opinion about what are the factors. We are talking about deficiency of micronutrients in pregnancy. So, what are the causative factors? Why does this deficiency occur, and in what way does it have adverse health outcomes?
Yeah. Specifically, we should remember that if we are talking about India, and India, we've got a different pattern. The role of micronutrients mainly in a woman starts if from the womb to adolescence, and then we come to pregnancy. Now, the question is, why is there a deficiency of micronutrients, especially in Indian women? Number one, the quality of diet in our country is not good. It's rather, I should say, it's poor. Like Nandita had said, that proper dietary mixture in our country is not right. We've got a very high fertility rate. We get repeated pregnancies, very little spacing between pregnancies, and there is an increased physiological needs during pregnancy. So the role of micronutrients and micronutrient supplementation in our country and in our women is very important. Now, if we go to the micronutrients one by one, if we talk about folic acid, like we all know that the incidence of neural tube defects in our country is around 3.5 to 4 per 1,000 total births. But that is not the most important part of it. Is one of the important part of folic acid fortification has got a role. But we should also remember that folic acid has got a role in cell proliferation, in CNS development, in cell repair, in the epigenetic expression of the genome, as Nandita had said, in the immune development, in the formation of RBC, and the deficiency. And the deficiency leads to deficiency or impairment of the immune system. Okay, zinc, as we all know, is very important for fetal growth and development, for the development of the immune system of the fetus. But deficiency is associated with lymphopoiesis and impaired lymphatic functions. It can cause fetal immune deficiency, thymic atrophy, distortion of the cell-mediated immunity, and mucosal integrity. Vitamin A, once again, is very important. Its deficiency is associated with disruptions in the mucosal integrity. The deficiency in the patients who've got vitamin A deficiency, there's a higher rate of development of respiratory tract infections, GI infections, and ocular infections. Moreover, there is also a reduction in cell-mediated immunity. Vitamin C, as Dr. Shanta was talking, vitamin C is also very important because in deficiency of vitamin C, there is an increase in oxidative stress. There's an increase in the incidence of pneumonia and other infections. And this is very important because we are in a phase where we are dealing with a pandemic, and this COVID has got very much high manifestations of pneumonia. Next, vitamin E, there is once again an increased susceptibility to infections, especially respiratory tract infections, and it promotes the Th2 and TREX signaling system. Cell-mediated and humoral immunity is also compromised in vitamin D deficiency. Iron, as we all know, it's important to carry oxygen fine, but it is important also for mitochondrial electron transport, for ATP production, for DNA synthesis, antioxidative stress reduction, and iron deficiency can cause IUGR in impaired immune system in the fetus also. Copper, once again, is very important. It leads to copper deficiency, leads to low neutrophil count, and there's an increased susceptibility to infection. Selenium, which is once again one important micronutrient, it leads to impaired humoral and cell-mediated immunity. There's increased viral virulence, and there is an inherent chance of recurrent respiratory tract infections. B6, B12, both are very important. B6 leads to lymphocytopenia, decreased cell-mediated immunity, and decreased antibody response. Vitamin B12 deficiency, nowadays we do B12 tests, and we see many of our women are deficient in vitamin B12, mainly due to the diet. Depressed immune, there is depressed immune response in response to vitamin B12 deficiency, and vitamin E also impairs both humoral and cell-mediated immunity. So if you take it in totality that micronutrients definitely does have a very big role to play in pregnancy and in the health of the fetus.
Yes, thank you, sir. Very well said. And like you pointed out, majority of the population of India, more than 85%, are undernourished mothers, which we see. And the prevalence of why micronutrient deficiency is so much is maybe higher parity. The interval between two pregnancies is less, and they go into the pregnancy with a negative balance of nutrition. Thank you, sir. So, Nandita ma'am, can we ask you the next question about calcium? So, what is the impact of calcium on maternal health, on the fetal health? Is there any role of calcium in prevention of preeclampsia or prevention of preterm labor? And what are the recommendations of calcium? How, what dose, and how it should be taken during pregnancy?
Sorry, my mic was off. I think, Debendu, that was a beautiful explanation how each molecule acts on the different aspects of immunity. I think if you can divide the immunity into natural and the one which are specific, he has described it so beautifully. So I really don't want to get into it. Only one thing before I get on to calcium is, I think immunity is, as I said, multifactorial. So even stress, lack of sleep, smoking, all those things along with your nutrition should be targeted when we're looking at a woman who's pregnant and we want to improve her immunity. So I think all these matters also are of importance when we get into it. Let's now come to calcium. I think calcium, most abundant substance in our body. It's everywhere. It's required for our bones, for our teeth. And did you know that only 1% of calcium is intracellular, in the membrane or in the extracellular space? I always thought, in fertility, when I used to think about it, I said calcium is required in every cell of our body. So we must, give it. I supplement all my infertility patients with calcium because I feel it's required for every process in our body. And it's so very important. And I think what we need to understand is that the fetal growth, the fetal development is dependent on calcium. And calcium which comes from the mother to the baby. And also that in the second trimester and the third trimester, you need maximum calcium. But I also feel that even in the first trimester, calcium is important because it's required for every cellular function of our body. So that little bit of calcium, the mother's diet, especially in our country, where there's so much of, deficiency of the diet, I think it's really important that calcium is supplemented. And I feel that there are lots of deficiencies in our diet. A lot of people don't drink milk. I don't like milk, for example. I hate milk. So there are lots of people lactose intolerance. So though milk is supposed to be the best source of calcium, it is not enough. So it's really required. So as you can see in the slide, it affects us in 3 ways. Of course, maternal bone changes are there. Gestational hypertension, preeclampsia, and preterm delivery. I think these are the very important things. Some things which I had taken out. I am right now seeing a serial on Mayan culture on Netflix, and when I came across this particular study which says that Mayan Indians never had PIH. Their incidence of PIH was very low. Why? Because they put lime on their corn, and that gave them a very rich calcium diet. Then even the Ethiopians, they have a diet which is very rich in calcium. So the incidence of PIH is low. And this comes to our next question which you asked me, is PIH, prevented? I know that there are a lot of studies, a lot of things, saying micronutrients do not help, a lot of meta-analysis and all that. But I personally feel that, RCTs, meta-analysis have its own place. But if you're doing something which causes no harm and which has been shown at a molecular level to make a difference in that particular way, like how Debendu was talking about immunity, so I personally think that it should be used. So in PIH especially, I remember there was a Cochrane review in 2014, and the relative risk was 0.45, and the range was 0.31 to 0.65. So definitely 31% to 65% there is reduction in pH with calcium. So what we use in our practice is we give about 1500 to 2000 grams of calcium. Now remember, Shanta Kumari just mentioned about the TOG which we had in Hyderabad, Shanta Kumari, and there was a lot of discussion in that TOG about calcium. And actually there is nothing that says that you have to take calcium regularly after 35. No studies which say. In a normal woman, what do you do? But I think in pregnancy, we have enough data to tell us. And the most important thing that we learned actually that day was calcium should be given in 500 milligrams divided doses. Why? Because if it's given in higher doses, it interferes with the absorption of iron and all. So if you divide it and even combine it with iron, it doesn't affect its absorption so much. So that was something, see, we keep learning everything every time you attend some meeting or a conference. And I think that is a very important factor of calcium, which should be known to everybody. That divide it in doses and you won't have problems with absorption of other things. The other thing that I wanted to say is, how does it cause the pH? You know, it increases the parathormone. What happens with the parathormone is it causes increase in the low calcium. Okay, so it causes increase in intracellular calcium and smooth muscle. What that does is, vasoconstriction, and the renin is released. So there's a sodium retention, and this can give rise to pH. And I think that's very, very important mechanism which we must understand, and we must use it to treat our patients. In India, all primaries are high risk. Okay, so every patient ideally should be on 1500 to 2000 milligrams. Also in those places where there are, multigravidas, but low calcium in the diet, those patients also should be given 1500 to 2000. It's usually recommended is 20 weeks, but I usually, on a personal basis, 16 to 20 weeks is when I start giving the higher dose of calcium, and it can definitely be given. The other thing is the WHO. As I told you, that is the WHO recommendation, by the way. And it prevents preterm birth also, and maternal osteopenia. So I think these are the fantastic benefits of calcium. The more said about calcium, it's always less. But I think I've said enough, and the sources and all, you are anyway telling us what it is. So I would hand over the mic to you for the sources.
Yes, ma'am. Thank you. That was really very well explained and told to us. Especially the practical point, like large dose, one large big dose should not be taken. It should be divided. And then what we end up seeing is people are given like 500 milligram calcium once a day. That is the wrong dose. Like you said, ma'am, you should give it in divided dose, maybe 500 3 times a day. That is the very practical and clinically excellent point which you have pointed out. Dietary source of calcium, we all are aware, dairy products, milk, cheese, green leafy vegetables.
Green leafy vegetables also. I hate them.
So all of us, especially our pregnant women.
Shanta, the cook, please tell us what you can make, how you can make it more tasty. Dipendu, do you like green leafy vegetables?
So that again is a very practical problem. So we need to address the calcium issue. Ma'am, Shanta Kumari ma'am, coming to you. I hope you answer Nandita ma'am's question also, and I also have a question for this panel. The question is, we'll come to vitamin D now. What is the impact of vitamin D supplementation on maternal health deficiency? What does it cause? And how does maternal vitamin deficiency lead to low birth weight babies? And will supplementation help? How do we go about this, ma'am, regarding vitamin D?
Yes, Vaishali, I think today I have to wish everyone happy hand hygiene day. Such a simple technique of hand hygiene. Today is the hand hygiene day. So let me wish all of you, yes, a happy hand hygiene day. This simple washing of the hands, which all of us used to do it, of course, only doctors and nurses, we all know the habit of having this hand wash. This hand washing, you know how it has changed the way of life now in the COVID era. Such a simple technique. Now, my mother always used to tell me behind my servants or anyone who comes, wash your hand, wash your hands. So the servants used to get wash your feet, wash your hand. So they get very angry with her. No, my driver, my cook, all were telling, Amma, Peddamma is right. She always told us correctly. We were grudging. So also this simple vitamin D, which we have taken for granted. We thought we have plenty of vitamin D. Always. We realize that this vitamin D is so very vital for every activity of the body. It is like the Hyderabad Jinda Talismat. Nandita knows what the Jinda Talismat is. This is an all-in-one balm which is available in Hyderabad, from headache to body ache to cancer to COVID also. Okay, earache, any ache, this Jinda Talismat will act. So the recommendation is 1,000 international units per day in pregnancy. Okay, so now coming to the food which is rich in vitamin D. See, everyone, whenever anybody Googles or anything, what do they find? They find smoked salmon, light tuna. You ask all our Indians, I don't know what light tuna is. Many of us don't know what salmon is. Honestly, that is not a part of. We know egg, but the amount of vitamin D in egg is less. So when you look at the other sources of vitamin D, so what orange juices, that and all we know. All our other fruits, sometimes guava, the routine seasonal fruits which we get in the market, they are rich sources of vitamin D. Milk, but again milk, how much we drink. The curd, yogurt, curd is a very important part of our diet, food. So it was a basic of any South Indian diet, and now I think the whole country, whole world over, everyone has yogurt for the breakfast. I used to wonder what yogurt was when I was a kid, Then I realized nothing but it's our dahi. So yes, that shows the importance of vitamin D. And people have realized that vitamin D is deficient. So they thought fortify what people will drink or food they eat with vitamin D so that deficiency is covered. So if you remember, we all realized the importance of vitamin D. I should be honest, it was thanks to the pharma. About 10, 12, 13 years back, when that concept of vitamin D deficiency came, I really rubbished it. I said, what are you talking? We in India don't need vitamin D supplement. We have so much of vitamin D. And there was a CME and a vitamin D of all the obstetricians were tested. 80 to 90% were deficient in vitamin D. So that shows how vitamin D supplementation is needed. And then lot of research went into, as I don't know, Nandita from where she sees this Mayan culture and all. I'm not having time away from Foxy and our webinars to see any culture. But definitely vitamin D supplementation is reduced risk even in preeclampsia. Maybe along with the calcium, they had vitamin D, your Mayan culture people, Nandita.
In the sun.
Sun. That is why they didn't have the preeclampsia. Then I'm sure if Hema was here, she would have jumped and told GDM, gestational diabetes. Again, vitamin D is the Zinda Talismat for gestational diabetes. I'm sure if you go back and see that serial, Nandita, I'm sure gestational diabetes also was less than Mayan culture because they had adequate vitamin D. And then the
fertility.
Before that, then infertility, yes. So if they had enough vitamin D, they wouldn't have gone to Nandita. They would have come directly to me and Dibendu. Correct? But unfortunately, vitamin D was there, so they went to Nandita. And she
vitamin D and PCO.
Yes.
PCO and vitamin
Again, vitamin D was supposed to correct the PCOS. Yeah. If you see, you look at our young girls, most of the young girls who come to us have obesity. They have PCOS. And maybe when you go into the history, it's again lack of exercise, lack of exposure to the sunlight and all of them. And these vitamin D deficient women, when they become pregnant, vitamin D deficiency is anywhere there. So that leads to the low birth weight. And there are studies which have shown that adding vitamin D supplementation definitely reduces the risk of preeclampsia. There are a lot of studies which showed that even vitamin D, if you supplement, the low birth weight, less than 2,500 grams, and there was a systematic review analysis, they found that this vitamin D deficiency was responsible for the low birth weight. And when you supplement vitamin D, automatically that response happens. You must have seen Dibendu, Dibendu, you all don't know, if he goes into his chamber, it will be only in the morning. If he goes, he only will come out in the midnight when there's no sun. So Dibendu definitely needs vitamin D. He's such a busy practitioner. He's either in the OPD or in the operation theater or somewhere. So I'm sure, Ribendu, we should send you some vitamin D, and you will agree with me that all the pregnant women, when they have this backache, leg ache, that ache, this ache, you give them vitamin D. Don't give painkillers when anybody has pain on the legs and backache. This is what I tell everyone. The bones are crying that they need calcium and vitamin D. That's why it's paining. They don't need ibuprofen. They don't need all the diclofenacs. They need simple calcium, vitamin D, and the micro and macronutrients, and automatically pain will reduces. So that is the importance of vitamin D in our day-to-day life. And this is one aspect I really like to appreciate the pharma, Somehow, I am being very honest, this vitamin D deficiency concept, I never believed till when the boom of vitamin D came, and when we started using them, then we realized the importance of vitamin D. So it is the Zinda Talismat, which is needed for all the diseases, even in osteoporosis, to infertility, to everything. All the practitioners of OB-GYN, be it obstetricians, be it fetal medicines, be it the infertility specialists or the gynecologists, they all need vitamin D. So vitamin D is the in thing now.
Yes, ma'am. So rightly said. And regarding role of vitamin D in immunity, it is an immunological agent. It has a immunomodulatory action. It is anti-inflammatory, and that is one more added benefit of vitamin D. And like you rightly said, ma'am, young girls nowadays, they don't exercise, they don't play outside, because getting exposed to the sun outside is so very important for adequate vitamin D levels, because the ultraviolet rays of sun fall on the skin, and then the metabolism starts with formation of vitamin D3. Now vitamin D3 is cholecalciferol, which is important. D2 is not important, it is orbocalciferol, and which further metabolized into the liver into 25 hydroxy cholecalciferol. So what is happening is, because as Indians, we have dark skin, the melanin is more, and hence the absorption, there's a problem. Even the custom of wearing clothes, because of the fully covered clothes that we have, the vitamin D formation synthesis is less. The pollution nowadays, of course, there's less pollution, but the pollution, the cloudy skies, all these are very detrimental. And that is why we need adequate vitamin D supplementation. And again, talking about fortified foods, we do have foods which are fortified with vitamin D. Thank you, Shanta ma'am. So can we move to Dr. Debendu Banerjee sir? This is a question to you about, we would like to know about metallo-enzymes. Now, what are metallo-enzymes? These are metals like copper and zinc and manganese and magnesium.
Metallo-enzymes said there are more than 300 enzymes which are affected by mainly 4 metals, that is zinc, copper, manganese and magnesium. And all these 4 metals play an important role in maintaining gestational health and ensuring a birth of a healthy infant. Well, some important enzymes, just to mention them, are glucokinase, chymotrypsin, aldolases, triphosphate, isomerases, and pyruvate carboxylases. These are very important enzymes in our system, and these enzymes are linked to these 4 metals. Now, if we go to them one by one, zinc, for instance, zinc is required for infant growth and development parameters, neonatal immune system, and for preventing infections in neonates. Copper, decreased copper is related to increased incidence of abortion and blighted ovum in certain studies. It is also a very sensitive indicator of pathology in pregnancy and in placental function. Now, if we come to decreased copper, may lead to increased incidence of preterm rupture of membranes due to decreased elastic and collagen tissues in the membranes. Manganese once again has gotten a very important role in bone formation and in metabolic regulation and formation as a cofactor in a number of enzymatic reactions. Magnesium, as we all know, decreased magnesium has been associated with preeclampsia. It's associated with preterm delivery, low birth weight, increased neonatal morbidity and mortality, leg cramps, fluid retention, and restless legs during pregnancy. These are so very common things that we get in our everyday practice. If you supplement magnesium earlier during pregnancies, various trials have shown that there is decreased numbers of maternal hospitalizations, there's a decreased incidence of preterm delivery, there is a decreased incidence of IUGR, and there is less frequent referral of the newborn to NICU. So magnesium once again has got a very important pivotal role in pregnancy. Next comes iodine. Iodine, as we all know, iodine has been associated with the increased incidence of abortion and stillbirth. In the fetus, there is a decreased IQ and there is neuropsychological development issues. There may be brain damage in the fetus in utero. There is mental retardation. There are psychomotor defects. So iodine supplementation in our country is very, very important. Over the past few decades, we all know that we get salt which is fortified in iodine. This, I believe, is a very, very welcome step in our country. Maybe it's a government initiative. It goes a long way in preventing long-term consequences in the fetus. So that's all about Metallo-enzymes.
Yes, sir. Thank you, sir. Thank you, sir. Very well explained. Thank you very much. Nandita ma'am, can we come back to you? And we would like to know about essential fatty acids, omega-3 fatty acids and the beneficial effects. And I believe there is a slight controversy about omega-6 fatty acids and omega-3 and what should be taken. Plus, coming to today's scenario with the pandemic going on, omega-3 fatty acid is supposed to be beneficial in today's time. So, can you just enlighten us about that?
I think there are more than 30 odd essential fatty acids. First, I should think fatty acid, heart protective, give it to older people so that as you go in menopausal, you must take it. It protects your heart and everything. But I think you have to understand that there are two essential fatty acids which are important. Omega-3 and omega-6, and usually there's a great balance in our body of it. If you see omega-3, it is the EPA, and omega-6 is actually arachidonic acid, which is a precursor of all our, PGE2, P2F2 alpha, thromboxane A2, etc. So in pregnancy, you want omega-3 to be more rather than omega-6 at the beginning of the pregnancy, because the uterus needs to be relaxed, and thromboxane A2, is the precursor of PIH. So we want that balance to be tilted. So we want more of omega-3. Also, the problem with omega-6 is, when it's taken in, it metabolizes into precursors, which actually compete with the omega-3. So then the effect of omega-3 reduces. So ideally in pregnancy at the beginning, what they say is don't have all this, the sunflower oil and all. I think you should take the flax seeds. Flax seeds are good. We all know. I have them every day in the morning, the flax seeds. Then soya bean oil or the soybean oil or the canola oil, because these are rich in omega-3. So don't have the sunflower and all, because that can cause an increase. And that is what the controversy is, because it causes precursors which block omega-3. So omega-3 is what we want in pregnancy. Then the other things like, when I realized that the benefits of this is multiple. And I think those were really something that really hit me hard. And I have really started using it in my practice. Yeah, Shanta, you wanted to interrupt?
Yeah, I just wanted, you were talking about all these oils. Now, I would like to know, those, instead of this canola oil and all, what about our routine, the groundnut oil and the mustard oil, which in Calcutta, Dibendu, do you have any idea how they're rich? This is my genuine, or mustard oil, which is also used.
Well, mustard oil was something which went into disrepute. But now it's said that mustard oil is as good as any rice oil or safflower oil.
Yeah, so mustard is supposed to be good for health.
Yeah, it's very good for health now, they say. So things are
groundnut oil also.
But you know what? I really don't know what the omega-3 and the omega-6 in the specific oil. So I think we need to get back and find out.
But this what we had a discussion. There was a nutrition girl, and she told this this cold, see, when we were small, we had the cold press oil. We had those oil ganagos, they used to get
Honey,
those.
deal.
So oil made out of the groundnut oil, it was used. And then nuvulu is what is that? Till oil.
Sesame oil.
Sesame oil, yeah. Sesame oil. These were all the routine oils used in this part of the country, like in our AP, Telangana and all we used. So we used, and when sunflower oil came, we all actually stopped and we all went off to this refined oil. This is again, we realized it was a mistake, and now we have gone back to the basics. Before COVID, we went back to groundnut oil, we went back to sesame oil, and they say change of these oils. So they are also having a bit of this omega fatty acids and all. Only when that nutritionist told, I remember, because most of us are not using the other oils which are there. I don't know about olive oil and all. We'll have to find out. So that's, sorry.
Ma'am, what you're saying is right. Omega-3 is there in soybean oil and flaxseed and all these walnuts and chia seeds. So omega oil is present in that, and omega-3 is more important than omega-6. Why? Because apparently omega-6 comes from the fish. The main source is from the fish, and with the high content of mercury in the sea waters, with the consumption of mercury by the fish, so there's a risk of poisoning. That's why omega-6 has fallen in disrepute, and omega-3 is what is more beneficial.
And all the supplements which are there, they have a very low level of contamination of mercury. Even if it's a fish oil supplement, the mercury content is very, very low in those supplements. So yes, it's better to eat small fish rather than big fish if they're from the ocean. Because the bigger the fish is, the more mercury content it accumulates. So it's better to have the smaller fish. Yeah. And I think the benefits of omega-3 are humongous. I was really excited when I gave the talk for Mayor only on omega-3 for preterm labor. And this beautiful Cochrane review, which has lakhs of women, and initially it was started because the nutrition contained it. And they showed that the preterm birth was much, much lesser in these women. So I think, in high-risk patients and all, we can definitely use it. The other thing is, of course, the neurodevelopment. And, starting from the second trimester, I think the development of the brain and the nervous system, everything is so important, including lactation period and till the child is about 1.5 years old. Because the intelligence, the memory, the language, everything is sure to be improved by adding omega-3 fatty acids. I think it's a wonderful supplement which would give us very good results. The other thing is that it also, I just put a question mark because of the thromboxane A effect of arachidonic acid, whether omega-3 would actually help us in reducing the PIH. But of course, there are no studies with it. That was just a thought process in my mind. The fourth thing is that decreases the infant food allergies and IgE associated eczemas also. And of course, very important, it reduces the depressive symptoms of postpartum period. B12 also, the B12 deficiency also causes depression. Now, this is something that should be checked in all patients because a lot of times the reduction in micronutrients actually causes depression also. So I think these are some of the very, very important aspects. Yeah, Debindu, you want to add something?
Yeah, the basic thing about omega-3 and omega-6, what you said, the thing that we need to remember is the ratio between eicosapentaenoic acid and arachidonic acid. Yeah. That is most important. Number 2 is this supplementation has to continue ideally up to 18 months of age because it gives immense support to the neonates. Retinal development is very important. Yeah. Omega-3 has got a big role, and there are clear-cut papers stating that it has got a preventive role in preterm labor. So these are things which are very well documented. What you said about PIH, exactly, if you go by theory, maybe there is scope for some studies. So, but actually, we never thought that omega-3 was so very important, but now we are gradually accepting it that it has got various uses during pregnancy.
And talking about omega-3, one more point I would like to just highlight that in today's COVID times, people are taking hydroxychloroquine as prophylaxis. And what happens with HCQ is there's prolongation of the QT complex, and because on the ECG, and because of which means that there could be ventricular arrhythmia and sudden cardiac arrest. So omega-3 protects this conduction mechanism and it prevents this ventricular arrhythmia. So if anybody is taking HCQ with ASI, then it is recommended that they should take one capsule of omega-3.
They can have, instead of the capsule, why can't they have a little butter or ghee which has omega-3 fatty acids? Better, no?
Yeah, and teal oil is supposed to be very high in omega-3. So home remedies. Yes, mustard oil, teal oil.
Groundnut oil just now I saw was omega-6 fatty acid excessively, but that also some conversion it is good. So everything is, oil is a very big confusion factor. But what I understood is butter and ghee is actually not bad, and everybody can take a bit of it.
Yes, yes. So coming back to our Indian tradition, the tradition of eating pure ghee is always been good, and we are moving away from it, especially the youngsters. Moving away from our tradition of tradition.
That is why when you're talking about micronutrients and all, you have made people move towards the laptop. You've got 2,000 plus people who have logged in. Okay.
Yes, more than 2,000 plus. Yes. So, ma'am, coming to you only, ma'am. Coming to now lactation and the infant. So, which nutritional supplements do they really help during lactation? What is your advice about it?
See, again, when you're talking about lactation, breastfeeding and all, we all still remember, we don't need rocket science. The simple basics, what did our grandmothers, everyone advise? In pregnancy, you need extra supplement of food. And when you're feeding a baby, you need to have more amount of nutritious food, because what the baby is going to derive all its micronutrients from the breast milk. So we know that the adequate supplement of the vitamins, minerals, everything in the mother's diet automatically makes the breast milk quite rich in all the required micro and macronutrients for the baby. That is the reason why in the lactation period, women are supposed to take a lot of nutrient-rich food. And we supplement also with all the micro and macronutrients if it is not adequately found in their diet.
So, yes, sir.
I think that's it. We know.
Yeah, and like coming back to our Indian traditional food, where the lactating mother is given all these homemade ghee and then different laddus and all. I think
that gond laddu, which even in our old city they used to give. It used to be with ghee and jaggery and nuts. All of them were a very nutritive value.
Right. So adequate nutritional supplement is very essential for effective lactation. Now coming to Banerjee sir, question to you about preconception recommendation before a woman plans the pregnancy. What care should she take? What are the recommendations so that she attains the optimum nutritional levels and optimum nutritional values?
Yeah. Basically, for the past 1 hour, we've been talking about we need micronutrients. So, as a healthcare provider, I feel that we should start before pregnancy. Most of the women these days come to us for a pre-pregnancy counseling. They are aware about the counseling effects. They are aware about certain diseases. So what we should advise them, and we know that this advice should start from the adolescent phase. We've been talking about a lot of calcium. Calcium supplementation is very important even in adolescent age, because if you supplement them in an adolescent phase, they have got a higher bone mass, a higher bone weight, and when they become pregnant, maybe they are better off than rather not taking calcium. So we should advise these women about a healthy diet. We see many women smoking and drinking. We should address this issue that you at least before getting pregnant, try to get rid of habits. Next is, if she is overweight, we should not COVID.
God bless you, Ravi.
Yeah. We should tell them to normalize their BMI before planning for a pregnancy. We should impress them what detrimental effects that obesity has on pregnancy, not only on pregnancy, on conception, and the further continuance of pregnancy, increased risk of developing gestational diabetes or hypertension, be it. One more point that I would like to stress, especially in our country, is if a woman comes for pregnancy counseling, we should always go for a thalassemia screen. Thalassemia is so very important in our country. If a woman comes to your clinic before planning for a pregnancy, do a thalassemia screen and do a rubella screen, it does a world of good to the pregnancy itself. And that, I believe, in nutshell, should be enough for a counseling.
Yeah, very rightly said, sir. So what you really mean is nutrition can be, micronutrition, undernutrition can be also dangerous, and macro means overnutrition can again be dangerous, can be in fact teratogenic in case of diabetes. So adequate nutrition awareness amongst these youngsters before going into pregnancy, simple thing like folic acid supplementation at least 30 days prior to planning the pregnancy.
Yeah.
All these factors are definitely going to help in the outcome of a healthy pregnancy and for a better fetal and neonatal outcome. We have few questions here for you, sir and madam. This question is from Dr. Sarika Singh, and she wants to know whether giving calcium combined with vitamin D3 is sufficient during pregnancy, or giving vitamin D3 60K for 8 weeks is necessary for every patient.
Yeah, I think what we need to understand is routinely we should not be writing 60,000 units for 8 weeks for all pregnant women. If you do a vitamin D level, if you find deficiency, then you should supplement. Because sometimes the patient may be having normal vitamin D and we'll land up with hypervitaminosis, vitamin D. So that also is not very good. So only if deficiency is documented, then you give this 8 weeks course. Otherwise, supplementation. Nandita has something to add.
Sorry, you know what, I had this question in my mind because low vitamin D in the first trimester causes a lot of problems, which even Dibyendu has said.
Yes.
So when I was asked a lot of questions. One of the people from New Bombay called me up. She was doing a camp during my Foxy year, and she said everybody is deficient in vitamin D in the first trimester, whether to give vitamin D in the first trimester or not. So I went through a lot of literature and I spoke to Dr. Rohit Shelatkar, who sent me a fantastic article that in the first trimester you should not give 60K, you should give 1,000 units per day only. You should not overload the patient. So in pregnancy, ideally it is good to keep her at 1,000, and even the 1,000 per day would take care of the deficiency. So 1,000 international units per day can be given even in the first trimester itself. Yeah.
Something else? Yes, sir.
If there is deficiency, you can start at 2,000 international units per day. You don't need to give it at 60,000 weekly for around eight weeks.
No, if the query is if there's documented vitamin D and she's in the third trimester.
Okay.
In that trimester,
you can.
Then you have to.
You can give 60K for 8 weeks after the first trimester is finished, when there's documented deficiency. That was the doubt of that.
And I would like the opinion of all our distinguished panelists about this also. Like RCOG says, there is as such no recommendation for routine screening of vitamin D for all pregnant women, but in our private practice all of us are doing it because vitamin D is so essential. We have just seen it. So if it is documented that vitamin D level is less than 20 Ng per ml, there is a deficiency, then yes, you need to give a higher dose of 60K every week. Otherwise, the higher dose is really not required if there is no deficiency, as you said. I would like the opinion of all.
Yeah, Vaishali, I don't think vitamin D test in the pregnancy is a recommendation. Even Foxy does a recommendation.
Yes.
So let us not give idea to this sort of.
Absolutely.
Individually, many people will do many things in their practice. That is an individualization of their practice, but not as a recommendation. Foxy doesn't recommend vitamin D as a routine for pregnant women.
So there is no recommendation. Foxy does not recommend. RCOG recommendation is also not there. So as such, no recommendation for routine screening of
Actually,
But I beg to differ here, Shanta.
Yes.
See,
No, not in pregnancy.
we know so many heard so many letters, so much literature saying that the deficiency causes so much harm in different areas of our
But
so that is the question which everybody is asking. What is wrong in doing it? It's not very expensive, I think.
we have to look at it as a public health issue.
Yes, public.
There are things which are public health issues. Same example, like right now in the COVID pandemic time, the question of doing an investigation of COVID tests in all population, all pregnant women. ICMR gave the guideline for doing for 5 days before, but in my state Telangana, we still, though the DMHO has given a directive, the private labs have still not been given an okay.
Yeah,
so we are not in a position to do.
So I think maybe you can just give supplementation universal, because I think everybody has a deficiency in our country. We girls don't like to go out in the sun. It's as simple as that.
That's why now under lockdown also I think maybe lockdown period everybody needs to take vitamin D. If you're not going out.
There is one more question here, ma'am. This is from Dr. Meso C. Gedeon. What kinds of food help to boost immune system in pregnant mother during this critical period of coronavirus?
Can I?
Colors. Yeah, go ahead.
I think this is a very interesting question and observation. You must be wondering, the food which we have, the food which is rich in the daily routine. See, our turmeric, they say, is an immunity booster. Our spices, cinnamon, is an immunity booster. There's a very nice, simple way I take it. I learned from a patient, let me be honest. I was having a lot of cough last year. Nothing was helping. So one patient came and told me, Madam, I will give you a remedy. You try this. I said, what? I am an ENT surgeon's daughter. Then she said, I'm going to teach you. I said, what? She said, you ground the cinnamon, make it powder, and you brew it like tea. After that, you add a bit of lemon and honey. And that will actually reduce the cough. And it did. This three combination I've heard that honey is also great energy, immune booster. So vitamin C, lime is an immunity booster. So all these spices are pepper. Turmeric, I believe when you're using, you have to add a bit of pepper. So that will increase. This I learned from that, who was that, Ravi Shankar Maharaj, I think. Yeah. He told I'm not very. So he has told when you're using turmeric, you have to add a pinch. That was the one thing I learned that day. You have to add a bit of pepper, I believe. That will increase the absorption of the curcumin in the turmeric. So these are all great energy boost, and fresh fruits, fresh vegetables. What my Chief Minister KCR told in SCC, he said, all of you in Telangana have lot of fruits. We have got lot of the sweet limes in the market. Now no export. There's all plenty. This is a season.
Mango.
No, sweet lemon. That was 1 month back. Now it's mango. In March, lot of sweet lemon, watermelon. He said all of these are there. Then lime. All of you have one that will improve your immunity and lessen the chance of getting. So true. I think all these are the supplements which you need to take.
And I think
the message here is home.
More colors you have in your fruits and vegetables, they have more antioxidants and they are good for your immunity.
I don't know, dry fruits and all, I don't know. So we'll have to, that everyone won't take, so it is okay. We have got enough of this, our routine food now, especially in this COVID time, I find the amount of fresh vegetables and fruits which are available in the market, we never find such things in the market.
Shanta,
so they're all exported.
Indian cooking is making fresh spices ka masala.
Yeah.
It's not like Chinese or Thai food where they have ready sauces.
Yes.
Remember that you're using fresh ingredients in your cooking. So that's why Indian cooking, if we reduce the carbohydrate content of our food, it would really be great.
I know, which is very difficult.
Okay. Yeah. So basically it's coming back to our traditional food, good food, turmeric, fresh seasonal fruits.
And not so exercise, jhadu pocha.
That's very important.
We have a question from Nigeria. And they've written, Dear Doc, as in Nigeria, we are facing the challenge of sickle cell and we are not recommended to prescribe iron supplements and folic acid. Kindly suggest me what to prescribe.
You can't prescribe. Anyway, Dibendu will tell that.
Dibendu.
Sickle cell, okay. Sickle cell, actually, we're not supposed to supplement iron or folic acid. So we only have to tell them to have rich micronutrient fortified food. Tell them to have a lot of this iron rich food and folic acid rich food. This is how I know is when when I had a patient, I asked my physician and also the hematologist, I said, now what do I do? So that's
dietary source of iron is important. Dietary source. Number 2, tell them they should avoid dehydration, because only in dehydration there is a chance of sickling. So
Crisis.
You cannot supplement them with iron and folic acid. It should be dietary supplements rather than medicinal supplements.
I would just like to announce here that we have audience from Nigeria, from Egypt, from Singapore, and Asia Pacific.
It's all for
we
the
have
beautiful.
gone beyond boundaries.
So Vaishali has become global CME.
Ma'am, no, that's you. That's all of us. That's TOG and this Foxy Perinatology Committee. Ma'am, Banerjee sir, this is for you. That how can we diagnose a deficiency in magnesium, the selenium, manganese, and all these Metallo-enzymes? How can we diagnose?
It's difficult to diagnose, and I don't think there is any necessity of diagnosing. We know very well that these metals are there in our diet, but in pregnancy the requirements are higher, which cannot be fulfilled by diet. So it would be prudent to add some micronutrients as a supplement in diets, rather than going for estimation of a manganese or a boron or a selenium.
I know.
By a blood study. That is superfluous. Just forget it and supplement.
Yes, supplement.
There's one more question from Dr. Meera Jha. She asks, what are the risks of giving 1500 to 2000 milligram of calcium per day? Should this be safe, and should be given only after doing serum calcium levels?
No,
Ideally, no.
Don't do again. Please don't do
No, calcium.
And it's not at all toxic or anything. 1500 to 2000 is safe.
The only thing is divide the dose. Don't mix it up with iron. Space it between iron and calcium. That should be fine.
Usually, what I do, I give calcium morning, afternoon, and give iron in the night.
Yeah.
So it's a simple way of trying to give it separately.
Yeah. And I think we are getting a lot of questions, but basically they are the same repetition, that what micronutrients, what nutrition, what diet. Basically, it's the same thing which is being asked again and again. There is one Dr. Alka Godbole. She wants to know diet for GDM patients. Some guidance about diet for GDM patients.
I think the carbohydrates should be definitely of low glycemic index. That is what is really important. And the other thing is that all the micronutrients and all should be added, because it really makes a lot of difference in diabetes, where if there are deficiencies in vitamins because of the oral diabetic drugs and all. So that care should be taken. But otherwise, I think sweet
and a high protein diet.
Yeah.
High protein, low glycemic index, and foods which contain a lot of micronutrients.
Nachni Vagre, she's from Thane, Alka is from Thane. So I think Nachni can be added to as a carbohydrate source, because it's really low glycemic. It helps all the diabetic patients and all. The cereals are not that great at in a diabetic diet. So you have to modify those cereals which have the low glycemic index. So I guess, you have to look at everything before prescribing it. And as Dibyendu has add a lot of proteins to her diet. So that would really work wonders. And, I use myo-inositol also in these patients to, it's a pro-vitamin and it has an anti-diabetic effect. So that also can be supplemented. Okay.
Yeah.
Okay.
Vaishali.
I think Vaishali is frozen.
Vaishali is frozen.
Let's have a look at the questions.
Nice.
We can have a look at the questions.
Yeah, she's looking nice, frozen.
Yeah.
This is a question again: what nutrients specifically consumed by a pregnant woman in this COVID? We have already told. I think fruits which are rich in fresh
must be
out of country. So basically, I think fresh fruits, vegetables with our Indian spices, which we taught, turmeric and yes.
Then
frozen Vaishali we have.
If I can get the mat. Oh, one sec.
Yeah.
Dear Doc Nandita, hi, I'm Dr. Oki from Center Hospital, Nigeria.
He wants your presentation.
I'm running an hospital. If I can get the matter, acha, presentation. I was
Okay.
wondering what this. So please, Subbu, you can give it to him.
Yeah.
Subbu, is he online?
Yes, he will. Now, what are the
Yes,
tips?
madam, I will organize.
Yeah. What?
Then,
Okay, Vaishali, can you take?
Yes, I'm here.
she's unfrozen.
Yeah, I've come back. I had little Wi-Fi problem.
Take the 13th question.
You were looking very pretty frozen also.
We like you frozen.
Thank you, ma'am.
In the
Thank
hot-
you.
In this hot summer.
You're looking lovely, ma'am. So are you.
Frozen
both of
desert.
you.
I was ready to sleep, yeah. It's 3 o'clock. 3 o'clock is sleeping time in non-COVID times.
Ma'am, most of them are, I think, repetitions of the questions that have come. So we would. There is one more question from Dr. Sampson. How does lack of micronutrient in a pregnant woman affect the form or shape of the baby? I think we have explained that.
No, I think what he needs to know
Talk
is
again, yeah.
the teratogenic, see the micronutrient deficiency, whether they're teratogenic, I think that is what he wants. So some deficiencies, we know folic acid deficiency resulted in all the neuro, what are all those, Dibendhu?
But IUGR is one of them.
Yes.
Preterm deliveries.
Yeah.
Small for gestational age babies because of nutritional.
It's actually supplementation of folic acid, B6, B12 together with zinc, which is very important. We all know that the incidence of neural defects and other organic defects increase due to deficiency of these.
No, so Dibendhu, I think the 3 mantras of this COVID lockdown, one is no pollution for the patients. They are eating only home food, okay, with lot of home food, and no stress of work and all, work from home. So all this are making them very healthy. They don't need any doctors now. That is why incidence of the routine colds, infections, diarrheas, dysentery.
Even the death rate, normal death rate has come down.
Yes. So all that, actually, whether to worry, our today I felt sad, 1,000 odd deaths with COVID. Yeah. But actually, when you look at the other, as Dibendhu has told, the accidents have gone down. Everything has.
The other stress
the strokes have come down.
There's a lot of economic uncertainty and all those things. So I think it's a mixed thing, and people are going through a tough time. So I think that
Actually, our life will change. It was like previously before Christ and after Christ. Now it is before Corona and after Corona.
We have to remain positive. Right.
So can we take few more questions, ma'am? And regarding the last question. There's one more aspect to these micronutrients. There are certain elements where excess dose can also lead to toxicity, like vitamin E or manganese or zinc can lead to toxicity and adverse fetal effects also. There is this question from, can we give iodine in first trimester in routine way? Dr. Om Kumari.
See, thyroid is very important. If it's low,
iodine.
You don't need to give iodine. Iodine is added as a supplement.
And salt is already fortified.
Fortified salt is there, so not necessary to prescribe it differently, right? And one last question we'll take. Any of you can take it. Role of lycopene and ginseng in pregnancy. This from Dr. Bidesh Biswas.
I'm not taking this.
Even I'm not using it.
What is the
Kanda?
Lycopene and ginseng. There must be a lot of
ginseng. These are not documented or recommended elements which are.
I have to tell you something. About this ginseng. When I was in school, that was the first time Revital and all ginseng came into. It was very expensive. One capsule used to be, I don't know, it was 20 or 30 rupees. One of my mamas, he was a film actor. He was a villain in the Tollywood. So, but those days, they never used the concept of buying tablets for health. It was a waste of money. So, I used to come and ask my dad, this ginseng is very immunity booster, good for health. You get me all the samples you give. So in those days, it created so much of enthu among people that people actually were buying also this ginseng because they thought it was boosting their immunity and boosting everything. But unfortunately, this uncle of mine actually died very early when he's in his 50s. But then that is what I remember. So ginseng, lot of people, and then now I think slowly that concept has gone, and now anything from China I'm not going to have.
No, it's a Korean herb. It's a Korean herb.
I don't know. I always thought it was a Chinese herb.
Yeah, even I always thought it was a Chinese.
But, it's a Korean
Radhika
herb.
went a step ahead. She said no Chinese food last time.
So actually, there are no recommendation or evidence regarding role of lycopene and ginseng in pregnancy.
No,
So we
you
did
know what?
not
I'm
comment
just
about.
reading. You should not use lycopene in pregnancy, in the early pregnancy.
Yeah.
The lycopene, which is
First trimester, it should be avoided.
no, only the natural lycopene in your tomatoes and all, which in the
Yeah, that's
adulterated is
okay,
enough.
but substitute
tablets, no.
supplementation.
Nothing in the
So,
first.
coming to the last concluding remarks now, I would like some word of advice and take-home messages, concluding remarks from a very esteemed faculty.
Yes.
Yes, Shantakumari ma'am.
So what we understand is if you have a good diet, which is having a lot of fresh fruits, vegetables, a mixed diet, you actually may not need a lot of supplements. But sometimes in spite of having all the routine diet in the thing, we may be deficient in the macronutrients. So we can take the supplements. But then don't overdo it. That's the only advice. Yes, Nandita.
I was just reading about lycopene, so definitely not to be taken as a supplement in pregnancy, even while breastfeeding. It's only in natural foods, it's fine.
Yes.
Okay, so I think personally during this difficult time of COVID, it's very important to have a very holistic approach towards a woman who's pregnant. You know, stress, sleep, good nutrition. I think supplementation, because you're not getting all the required micronutrients, etc., will help us to achieve a pregnancy which is very good. See, because we have talked about the fetal origin of adult disease, and we must not forget this at the back of all our discussion, is that if we do not keep her healthy during pregnancy, if there are problems in the 9 months, that fetus will have problems in adulthood, and we need to really take care of that. So all of us need to give absolutely good antenatal care and prevent complications.
Yeah,
Banerjee, sir.
Yeah, as a healthcare provider, I believe my aim as obstetrician would be to end a pregnancy with a healthy mother and a healthy baby. So keeping that in mind, we should advise them a healthy food, decrease stress, and micronutrients or macronutrients as much as required. No, don't overdo it. Do a bit of exercise, do a bit of meditation, and in the end of 9 months, you'll be blessed with a healthy child. That's it.
I think wonderful take-home messages given by all our three very esteemed panelists that follow natural method, enough sleep, no stress, natural, good, healthy diet, balanced diet with all food groups, exercise, meditation, and all these good, healthy things will ensure that there's a healthy pregnancy and a healthy outcome to that. So thank you very much. All are very, very esteemed. It was indeed an honor to moderate this panel with Nandita Madam, Shantakumari Ma'am, and Banerjee Sir. Thank you to all our listeners. Yes, ma'am.
Before you end, I just saw that last question. Somebody had a doubt whether papaya and coconut can be.
Ma'am, please go ahead.
So that's a very interesting and a very common doubt among all doctors and patients. See, many people say, let Dibendu, what is your take?
Yeah, the people come and ask us about two things. One is papaya and pineapple. So I say it's not there in our textbooks.
No, but let me be honest. You know what I say?
No. In Ayurveda, there is this thing that raw papaya, if taken in a higher quantity, may lead to abortion.
Yeah, it has water-based enzymes.
Yes.
Yeah. So I say that whatever you feel, I as a medicinal person will say, I will never say no to these, but if you feel that you've got something in the back of your head, listen to it.
What I tell is, we have got so many fruits. If you don't eat papaya for 9 months, nothing will happen.
That means you're saying no.
They want me to say no.
Oh,
So
But
that's
Shanta, it's very rich source of vitamins and
Vitamin
very
A,
good.
yeah.
but the psychological effect.
No, even I tell them not to take. But
I
I
honestly tell them.
effect is always there, Shanta.
don't think it's
They
correct.
tie the petticoat high up. I tell them, you tell your mother-in-law that your baby will not come out of your mouth. So be relaxed.
So what do we answer, Dr. Ghazala Yasmin? I think we should answer
Does
why
not
papaya is good. It is rich in
matter.
vitamin A, and
No,
coconut
no.
water is.
I'm sorry. I wouldn't advise that because let me be honest. In my practice, of course, it may not be evidence based and all, but when that patient and so all the people have that fad for papaya that you say, what is wrong? They can have other fruits. They can have guava. They can have watermelon. They can have mango.
Well, if
So
it's
many fruits are
ripe
there.
and you don't eat the seeds, I think it's pretty safe.
So, but if they're scared, no harm in not eating. That's my take.
We'll have a debate some other day on this.
Papaya debate.
Ma'am, that's why you wanted to take this question.
Yeah, that is why I asked this question. I saw that. Because you made us lose we are not getting one day also free to relax in the lockdown.
Yeah.
I really appreciate. We really appreciate that you have given us time, three of you, and been here on this panel. It is a great honor for my committee, Perinatology Committee, Foxy. Thank you very much to all the people who have logged in and are listening to us. Thank you to TOG, Mr. Subbu, Srimon, Meenal, everyone, and thank you very much.